In late 2019, a microscopic virus emerged. This tiny particle, known as SARS-CoV-2, began its journey among humans, spreading rapidly and transforming lives across the globe. As the virus entered through the nose and mouth, it attached itself to lung cells. Inside the body, it multiplied swiftly, leading to the onset of what we now know as COVID-19. The ramifications were immediate and profound. Cities began reporting cases, and soon, world maps illuminated with the spread of the virus. Airports buzzed with travelers unaware of the looming threat. And crowded streets turned into scenes of uncertainty as news headlines filled with warnings about the pandemic. Hospitals soon became overwhelmed with patients, their hallways echoing with the urgency of healthcare workers clad in protective gear. Lockdowns were imposed, roads emptied, and social distancing became the new norm. Masks turned into essential daily items, and lives were put on hold. The world was changing, grappling with an unprecedented crisis. Meanwhile, in scientific laboratories worldwide, researchers worked tirelessly to understand this new enemy. They collaborated across borders, sharing insights and data in a united effort. Genetic sequencing of the virus revealed its structure, and advanced laboratory equipment was put to work as scientists engaged in computer simulations to find answers. The spotlight shifted to vaccine development, an urgent priority to combat the virus. Step by step, mRNA vaccines and traditional vaccines were designed and rigorously tested. Each phase of clinical trials provided critical insights, and health authorities closely evaluated the results, leading to approvals that would change the course of the pandemic. As mass vaccination campaigns rolled out globally, communities rallied together to receive their shots. The sight of long lines turned into scenes of hope as millions rolled up their sleeves. Gradually, infection rates began to decline, and hospitals filled less as vaccines proved effective in reducing severe illness and death. The collective effort of scientists and healthcare professionals bore fruit, showcasing the power of vaccination in the fight against COVID-19. However, the pandemic was not over. New variants emerged, and research continued. Scientists remained vigilant, monitoring changes in the virus and adjusting public health measures accordingly. The need for booster doses became apparent, and improved treatments were explored, paving the way for the transition from pandemic emergency to long-term management of COVID-19. The world learned to adapt, implementing strategies to coexist with the virus while maintaining safety. Public health guidelines evolved, ensuring that communities remained protected even as life began to return to some semblance of normalcy. As we reflect on this journey, it is essential to recognize the silver linings amid the challenges. The pandemic taught us valuable lessons about scientific innovation, global cooperation, and the importance of being prepared for future outbreaks. We witnessed firsthand how humanity came together, rallied by a shared purpose to combat a common threat. The role of science became a beacon of hope, showing that through collaboration and resilience, we can overcome even the most formidable challenges. Today, as we look to the future, we carry with us not only the scars of this pandemic but also the inspiration that emerged from it. The story of COVID-19 is not just one of loss and suffering. It is also a testament to human ingenuity and the relentless pursuit of knowledge. As we continue to monitor the virus and adapt our strategies, let us be reminded of the importance of preparedness. Our experiences have equipped us to face future health crises with confidence. In the end, the journey through the COVID-19 pandemic has reaffirmed our collective strength and commitment to safeguarding global health. We are left with a hopeful message that science, community, and a spirit of perseverance will always guide us through the darkest times.